the story behind DBS and Alzheimer's disease is kind of an unexpected one. And a lot of people kind of jerk when you say that, because you don't think about Alzheimer's disease when we're talking about DBS. You think about tremor, you think about Parkinson's disease and other things. But there was a report published in 2008, I believe it was, where a patient experienced flashback-like episodes when they were receiving or when they were getting implanted with DBS for the treatment of obesity. And they were targeting the hypothalamic region. And so that led to some theories that, well, perhaps we're close enough to memory-related circuits like the Papez circuit, the fornix being involved in that area. Perhaps we're close enough that we're modulating those circuits and triggering up these memories that have been dormant for many years. If that's the case, then can we tailor this to actually be a treatment? And so that led to the idea of directly stimulating the fornix, again, with the idea of modulating the Papez circuit and helping to improve memory. Up to this point, there have been over 100 people that have had this procedure done, having bilateral DBS to the fornix, and the results have really been mixed. There are debates on why the results have been mixed. I mean, is it related to patient age? Is it because of the disease, not just knowing how progressed the disease is, but what is the disease you're actually treating? Are these pathologically confirmed patients? Also, lead location. We're talking about a neurosurgical procedure, and the leads aren't going to be in precisely the same place in every patient. And then stimulation parameters as well. We're not just putting leads in and calling it a day. You have to program these, and anyone that's programmed movement patients are very familiar with what that process looks like. And so you can imagine trying to program someone for cognition is going to be a different beast than programming someone where you're trying to get their tremor to go away. So those are all things that have been kind of thrown around on why the results have been mixed with phase 1 and phase 2 clinical trials. There is a phase 3 clinical trial going on right now in mild AD. So we're eager to see what that one's going to show. I think we'll have a lot more in terms of answers once that's finished. But there was a nice study published in 2022 looking to try to answer that question of, is there anything we can glean from patients that have had this done that tells us, yes, it works, no, it doesn't, maybe what the sweet spot is. And so in an analysis of 46 patients from multiple centers. All the patients had bilateral fornical DBS stimulation. They had the same parameters, 130 hertz, 90 microseconds. And they found that the majority of active contacts on the DBS electrodes were within 2 millimeters of the Papez circuit and within 2 millimeters of the bed nucleus of the stria terminalis. And so then they used some very fancy kind of modeling techniques to see if they could find a sweet spot, if you will. And it does seem that the sweet spot associated with the best cognitive outcomes is really at the interface between the Papez circuit and the stria terminalis. So I think it'll be interesting to see how things go from there. It looks like we've got a good target. Obviously, programming is going to create some interesting challenges, but the book is not closed on DBS for Alzheimer's disease. We're excited to see what's going to come of that.